In this session, let's answer one of the most important questions that is usually asked before surgery. People always ask what kind of incision this surgery is done with, where exactly the incision is located, and whether these incisions will be visible after the surgery or not. When it comes to incisions, in plastic surgery on the face, the incision should be hidden or made less visible. These options are somewhat contradictory. Be hidden or in. We should place it where we can hide them in the future or conceal them. These two options are contradictory, and if I explain incisions, you'll understand these contradictions. 1. Incision in the forehead is for endoscopic surgery made within the hair. These incisions are covered by hair. They should remain hidden after surgery, even if healing isn't perfect. We simply use forehead because when we perform surgery, we make endoscopic incisions that are placed within the hair. The nature of these incisions, due to their location, is that they are covered by the surrounding hair. In fact, we can say that they should remain hidden from view after the surgery, even if the incision site doesn't heal perfectly. These incisions still won't be visible. The feature of endoscopic lift incisions is they are small, between 1.5 to 3 centimeters, and there may be 3 to 5 of them in the center or sides of the head. Typically, these incisions are spaced out, following the natural lines of the hairline to not be visible from the front. Another incision for open surgery might be within the hair. These larger incisions are within the hair, away from the hairline, but shaped differently. They might be visible from some angles. Just have with pot. Another incision placed within the hair is for open surgery. These larger incisions are positioned away from the hairline, placed within the hair, but their shape is different. However, they might extend from one side of the face to the opposite side, possibly a half-moon shape. You can use a headband to cover these incisions, which gives access to the upper part of the face and forehead. We proceed to more exposed incisions for individuals to achieve a longer. It can extend from one side of the face to the opposite side, meaning it can be half-moon shaped. You can actually use a headband to cover these incisions, which provides very good access to the upper part of the face and forehead. After this incision, we move on to the incisions that are more exposed. We make visible incisions in front of to prevent the forehead from getting longer and to keep the hairline higher. We use incisions in front of the hairline. The difference between these incisions and those made within the hair is that hair follicles can cover these incisions to some extent. However, we know that the lower part of these incisions is hairless, which can make them more visible. In this area, we usually use techniques that create visual lines to make it harder to follow the incision line. One of the techniques is to make the incision in a broken or zigzag pattern, so by breaking this line, the eye can't easily follow the path of the incision. It should be positioned at the edge of visibility. In this part, we use techniques creating visual lines, making it difficult to follow the incision line, making the incision in a broken or zigzag pattern, thus breaking it. The eye can't easily follow the incision. These incisions typically aren't visible, and often hair follicles conceal them. The next incision could be one that takes place in the middle of the forehead. In some facial structures, it is not seen often. The hair follicles that come out from these incisions help to conceal them. The next incision could be one made in the middle of the forehead. Is it possible to make an incision in the middle of someone's forehead and hide it? Yes, that option exists. Fortunately, in individuals with a certain facial structure, the healing of the wound is done very well, and we can usually make the scar line extremely precise, meaning it can be very, very thin. If we also match the color with the surrounding skin, whether it's lighter or darker, it can blend in well. The wound healing is done very well, and we can usually make the scar line extremely precise, meaning it can be very, very thin. If we also match the color with the surrounding skin, whether it's lighter or darker, it can blend in well. There shouldn't be any skin. Well, it should fade away. We choose this brush for people who have very odd folds in their forehead. The important thing is that such an incision should not be used on a young person or someone who doesn't have any wrinkles in these areas, because it can show a bad scar or a poor healing site. In the incision we make at the edge of the hairline, we create an upper line, and as mentioned in the initial incision, a scar can appear in the incision area. At the hairline edge, we create an upper line, hiding it at the hair roots, and concealing scars is possible. Direct access to the eyebrows is helpful. The upper incision benefits from a groove that, when eyes are closed, prevents skin pulling, ideal for hiding scars. Close your eyes, and in this area, we hide the incision, concealing scars. The upper incision benefits from a groove that prevents skin pulling. In the eyelid groove, we make our incision, naturally concealed. For the lower eyelid, an incision is made. The incision used for surgery, especially in the upper part, fortunately, has a groove here that, when the eyes are closed, helps to keep the skin from being pulled in too much, making it a suitable place to hide scars or healing sites. Close your eyes. And indeed, in this area, our eyelid groove creates our incision, and when the eyelid opens, we can see that the incision line is naturally concealed, just like the mark I made on their eyelid is hidden. One of the incisions used for the lower eyelid is made just below the lashes with a very small distance. This way, the shadow cast by the lashes helps to conceal it. We create the eyelid groove, and when the eyelid opens, we can see that the incision line is naturally concealed. A lower eyelid incision is made just below the lashes. The lash shadow hides the scar. Side incisions can be placed in natural eye folds to conceal them. In individuals where we perform a lift is given. This way, the shadow that the waves cast, the scar falls on this area, keeping the incision hidden. While some parts of the incision might be visible, we place the side incision in a natural fold around the eye, helping to conceal it. In mid or lower facelifts, when done endoscopically, we use incisions hidden within the hair. If done openly, the incision is made right in front of the hairline, just below the hair, keeping the incision easily concealed. A major advantage is having excess skin. We perform the mid or lower facelift. If done endoscopically, incisions are hidden within the hair. If done openly, the incision is made in front of the hairline, just below the hair, to conceal it. A major advantage is that removing excess skin takes away non-hair-bearing skin, making it easier to hide. Alternatively, incisions within the hair can be used, but studies show that placing the incision within the hairline can increase the distance from the hairline significantly when lifting. We will remove the skin that no longer has hair. You can. Incisions within hair can be used, but studies show that if incisions are within hair, removed skin is hairless, increasing hairline distance. Around face and temples, hairline seems receded, making face look lifeless and older. Experience shows placing incision in front of hairline maintains it, enhancing facial beauty. Near ear, incision is in grooves, making it less visible. The hairline around the face and temples receded, making the face look lifeless and older. Experience shows placing the incision before the hairline to maintain it enhances facial beauty. Near the ear, we place the incision in the grooves to hide the incision. At the tragus edge or front ear tissue, we make the incision, creating a break in the line to make it less noticeable. In the front part of the ear, we place the incision in the grooves so that the incision site is not easily visible. At the edge of the tragus or in the tissue that is in front of the ear, we can make the incision. And here we create visual lines by breaking the incision line a bit lower, which makes our incision site easier to conceal. People that I can't see. In men, the issue is that when we remove the skin, the excess skin can actually pull on the hair follicles of the beard, and these follicles can come out and block the area in front of the tragus. From this angle, it's clear. We can make the same cut as women do, but we should remove the hair follicles here in the middle with laser or through another method to prevent hair growth in this area, which can be unattractive. Another way is to bring the cut from behind to a more forward position. This way, you won't have the hairline further back from this area. After the face, we move on to the neck areas, and for the neck lift cut, we use the crease behind the ear. You will not move your growth line further than this. After addressing the face, we proceed to the neck. For a neck lift, we cut behind the ear, using its crease to hide the incision. This area heals well, leaving no visible scar. We may also cut in front of the face, along the jawline, or under the nose for an upper lip lift, where the nose shadow conceals it. For a rectangular lip surgery or direct lip lift, the cut is along the lip line, blending in post-surgery. And the cut where the stitches are placed will heal well later, and the scar won't be visible. We might use cuts in the front areas of the face and place the cut along the jawline, or for lifting the upper lip. We can place the cut under the nose this way. The shadow of the nose helps to conceal the cut location. For people who want to have a rectangular lip surgery or perform a direct lip lift, we can place the cut along the lip line, and after the surgery, it will blend in nicely. We can place our cut under the nose like this, so the shadow of the nose helps us hide the cut location. Then, for people who want to have a rectangular lip surgery or perform a direct lip lift, we can position the cut along the lip line, and after the surgery, it will blend in nicely. He just saw Takulu right in this creek. The line of our cut will be hidden, so if we want to do surgery later, we can conceal it with the contours around the lip. Same for the lower lip, to cut along the lip line for surgeries. Some cuts might be inside the mouth. For chin or cheek implants, use intraoral cuts. Same for jaw angle. Inside the mouth, cuts leave no visible marks outside. For neck lifts, especially with severe sagging, cuts might be needed in the neck. Use intraoral cuts. For implants, mouth cuts leave no marks. For severe neck sagging, a wider cut may be needed. Extend cut in front of hairline to remove skin. Sometimes hide cut in hair during lift. Inside the mouth, we can make cuts, and there won't be any visible marks on the outside from these incisions. When we have neck lift surgeries, especially those with severe neck sagging, we may need to widen our neck lift cut. So, besides the crease behind the ear, we extend it in front of the hairline and remove excess skin. Sometimes we place it within the hair, and during the lift, we remove excess skin, so the rest is hidden in the hair. We widened it, meaning that in addition to the crease behind the ear, we bring our cut line in front of the hairline and remove the excess skin from this area. Sometimes we can bring our cut line into the hair, and during the lift, we remove the excess skin from this area, so the rest of our cut line will be hidden in the hair. In some cases, when we want to correct the front parts of the neck, we can use a chin procedure. We can go under the chin. It should be hidden. Some thoughts. When we want to correct the front parts of the neck, we can use a chin procedure. We can go under the chin. And this cut is usually parallel to the line under the chin, which helps us easily hide the cut. The shadow that normally falls in this area under the chin helps to conceal the cut. For nose surgeries, the cut might be made inside. In open methods, the cut is usually made underneath the nose at the columella. The skin in this area is lifted and the surgery is performed underneath the skin. The incision will be made and the color method will be used for the surgery. In open methods, the cut is usually made underneath the columella, and the skin in this area gets lifted and a procedure is done under the skin. For people who need the area around the nostrils to be fuller, the cut is placed in the groove between the nose and the face, and this cut can easily be hidden within that groove. To select the incision for surgeries, start from the forehead. For eyebrow and forehead lift, prefer incisions within or in front of the hairline. To avoid a longer forehead, incisions should be in front. For people who need an eyebrow lift and want their forehead to be lifted at the same time, we prefer those incisions that are either inserted into the hairs or removed from the hairs. An incision in front of the hairline prevents receding and keeps the forehead from lengthening. If concerned, your forehead might shorten during surgery. Ensure the incision is in front of the hairline. This allows us to adjust the hair area, moving tissue forward to shorten the forehead. This is crucial for those with lower forehead sagging, where bone shaving or reshaping is needed. Sleep a little bit more so that we can cut the hair. And we need to move the tissue, moved forward to shorten your forehead. Lower forehead sagging, we might reshape or shave the bone. Wider incisions are needed for better access than endoscopic ones. Incisions can be within or in front of the hairline based on hairline distance from eyebrows. This can be discussed beforehand. Sometimes only part of the bone needs addressing. It's necessary to choose wider incisions as we can't access with an endoscopic incision. Incisions can be in the hair or hairline based on hairline distance from eyebrows. Sometimes only part of the bone is needed. The eye area needs shaving. No extensive central shaving needed. If sides need shaving, wide forehead scalp incisions aren't needed. Smaller, higher incisions can access and shave individuals, only part of the target bone. Shave the eye area. If shaving the sides, smaller incisions can access the area for shaving. Facial lift incisions provide good access to the eye socket edges. This is ideal for those with mild mid-face sagging. An endoscopic lift is a suitable option. With incisions within the hair, we can access the side forehead and upper parts effectively. When we consider a facelift, it gives us access to the edges of the eye sockets, allowing us to shave down the edges and achieve the desired shape in individuals with mid-face sagging. For those interested in a temple lift and cheek procedures, we offer an endoscopic lift. Incisions are within the hair. We access the forehead sides and upper parts. We use mouth incisions to release lower areas, enabling seamless cheek and temple lifts. For the cheek area, we have a very suitable option, which is an endoscopic lift. The incision is made within the hair, and unless you specifically want the incision to be in front of the hairline, we can achieve very good access to the side areas of the forehead and the upper parts. This way, we can effectively address the cheek and temple areas. To improve the surgical outcome, we use incisions inside the mouth to free the lower areas, allowing us to perform the cheek and temple lift smoothly. We consider your desires to select the incision suiting your needs. Whether you want a shorter or longer forehead or minimal invasiveness, your incision will differ from others. We prioritize your desires, choosing the most suitable incision for you. Whether you want a shorter forehead, your incision will be tailored. Choose the option that suits you best and is closer to your desires. If you want a shorter forehead, or if you prefer a longer forehead, or if you want your surgery to be as minimally invasive as possible, your incision will be different from someone else's, who may prefer the same surgery, but in a different way.